Hi everyone, welcome to the Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices, where we aim to hear from young people and specialists about youth health priorities in the NT. A special shout out to our sponsors for this event, including Hot North, CDU, the Northern Territory Government, NTPHN, Bridging the Gap, Ironbark Corporation and Charter Air. I'm Lateesha Jeffrey, and today on episode 5, I'll be having a chat with Rachel Buckley. Rachel Buckley is a clinical nurse consultant in adolescent health in the Northern Territory and an Honorary Clinical Fellow at Menzies School of Health Research. In her current role, Rachel has been responsible for contributing to system change and redesign of the adolescent health service to promote safety and equity for young people. Rachel is currently undertaking a study looking at the value of opportunistic screening in hospital settings, creating opportunities for interventions and a change in trajectory, particularly for at-risk youth. Welcome to the podcast, Rachel. Thank you for joining me. How are you going today?
Yeah, I'm good, thank you. Glad to be here. How are you?
Yeah, no, I'm really good, and I'm excited to have you on here today as well. So we'll just get straight into it. So first off, you were involved in the first 2019 Youth Health Summit, which was held in Darwin. Can you tell us about some highlights that you remember about this initiative?
Yeah, I think firstly, I guess just on a personal experience, being involved in the process from the beginning, from the sort of design and planning of the day was really cool to see how it all unfolded. And I think also sometimes working in clinical areas, doing adolescent health, you don't really always get to know who else is around. And so I think, meeting the people that are really passionate about youth health too is also it's really cool. It's just a really positive experience from that side of things. And then I think, aside from that, one of the things that I guess I took away from the day more than anything was I think sometimes health professionals or policymakers or researchers, we have an idea of what we think things should look like, but actually, young people themselves usually have a better idea of how it looks like, and actually, sort of put you on a bit of a different path. And just really listening to the differences in those sort of perspectives, I think was really cool. And it just makes you realize that, I think sometimes consultation processes can be a bit tokenistic, and just to try and really avoid that and make sure that you're really hearing, and interpreting what people are saying and making sure that that translates to action. So yeah, it was really cool.
Yeah, it sounds like it was really good. So, and you work with young people as a nurse at the hospital and at Menzies as a clinical research fellow. What is the best part of your job?
Look, honestly, it's just the young people. I think that I meet so many amazing young people through work who have just got so many different backgrounds and stories, different really interesting cultural perspectives. And I think that actually, getting to be a part of their journey and sort of, sometimes young people, they might be having a really difficult time, or, they've just got a lot going on in their life, especially, usually when they see me, that's usually why I see them a lot of the time. And I think that actually hearing how resilient they are is really amazing, but also just being part of that process where they know that, oh, I can talk to this person and they might help me sort of figure out how to get in a different path is just really cool. And I think part of the service redesign stuff as well, it's really nice. It's a lot of hard work and to really try and get through the systems to sort of improve things, but actually when you see that does improve access for people that don't have access to necessarily specialist services or that don't have appreciable health outcomes, but it's just it's all worth it. So yeah.
Lovely. So, and some of the research you do involves a retrospective clinical audit. Can you tell us a little bit about what this is and what you have or are hoping to learn, and how this might have changed how young people are treated when they're admitted to hospital as well?
Yeah, so I guess the retrospective clinical audit, it's a descriptive study, and so it's nothing super high level with the data or anything, but really what we're looking at is we're going over a year period, so we're looking back over a year, and we're looking at we're taking a number of young people that got referred to our service, and that ended up being 134 young people, and obviously all that data is de-identified, so we won't have to worry about that any of that might have come up. And basically, as part of the Adolescent Health Service, it's really the sort of standard clinical approach is to do a psychosocial screen for everybody that comes into hospital. And so that means, for example, so we do head screening on the most part. So a head screen stands for like home, and we'll look at things such as homelessness, overcrowding, just whether, you know, they have they're really happy at home and their family relationships. You know, then we'll ask about education, exercise, eating, so whether that, you know, could be issues with eating or food insecurity, activities, physical activity, peers, family, drugs, alcohol use, safety, suicides, the mental health type of stuff, and injuries and violence. And then we'll ask about sort of spirituality and those different things. So it's like a really sort of comprehensive, like mostly, you know, in hospital, like a biopsychosocial approach. And so what we've done is looked at the clinical records and sort of created this tool to try and capture all of that information to really explain what our young people are going through, and, you know, what sort of issues they're struggling with. But I guess, you know, also which areas that they're thriving, and, you know, we sort of call this risk and protective factors. And so, you know, what are you putting young people at risk, but actually, you know, what areas do we need to sort of understand about what positive is going on in their life, so we can sort of redirect a lot of our healthcare planning and clinical service delivery around those things as well. We also then looked at 13 key indicators. So out of this sort of head screen, we picked 13 things that we thought were really important, and then compared to see if people didn't have this screen, were these things captured just as part of a regular clinical encounter without, you know, that sort of question, you know, that screen done. And actually showed that the coverage was really low. So, you know, as part of general routine care, somebody comes in with appendicitis, or they come in with, you know, road traffic injury, they're not going to ask these questions, you know, about have they felt suicidal recently, or what's their sexual, you know, reproductive health. And, you know, that coverage is really low. And so what it sort of shows us is that, one, we need to be asking the questions, but two, you know, if we do ask those questions, then we have a real chance at that point to sort of put interventions in place and refer to community services, so that young people, you know, can sort of get access to the help that they need.
Yeah. Well, it sounds like a lot of information that you're, you know, gathering and getting off our young people to come up with those kind of resources. And a part of your research is understanding psychosocial protective factors of young people who come to hospital. So can you tell us some of, you know, some of these, and which can help people achieve good well-being as well?
Yeah, so I think, you know, even just like a tiny step back from that, in terms of, you know, we tend to, I think one of the things that sometimes we do as health professionals is we do focus on risk a lot. And, you know, because obviously we're working in sort of high risk, you know, with high risk situations, but with young people with a lot of stuff going on. And, you know, obviously we really need to acknowledge and work through those things. But I think what we don't focus on enough is, you know, what young people, like, who their support systems are and what that looks like for them, and where they go to seek help. And so, you know, within this study, it sort of showed that actually, for example, because it looked at Aboriginal and non-Aboriginal young people, so just all young people that referred to our service, but especially for our cohort of Aboriginal young people, it really showed that they were spending lots of time with their family, and that was so important to them. And, you know, that they were actually participating in a lot of stuff in community, you know, in terms of ceremony and, you know, like sports carnivals and like just all this really amazing stuff. And if we know that information, then we can say, okay, like these are the really good things going on in your life, or these are the people that you go to when you're struggling, and how can we like adapt this health plan around those things. I think people don't understand that context. I mean, it kind of doesn't really, you know, I mean, the key to success is understanding where people are actually doing really well. No, so I think it's, you know, looking at those things is just really important in all of our work, you know, all of the health work with young people.
Yeah, definitely. And just bringing that to light for that young person, probably not even realizing all the positive things that, you know, they are naturally doing in their life as well. So why do you, and you already touched on this in the first question, about, you know, why do you think it's important, young people's voices and opinions informing health professional and policymakers on how to deliver services in a safer and better, you know, way? So yeah, why do you think it's important that we're actually engaging with our youth to do this part of our work?
Yeah, and look, I think that really they're the key architects, aren't they, of our future service delivery? Like, they know what it should look like. They know what they expect from it and really what suits them. And I think that what I really enjoy about our next sort of generation of young people is that they actually seem to care a lot more about like community, like our community and collective participation and like good societal outcomes. And I think that that in itself will broadly sort of shape our future service delivery and what it looks like. And that's just something that we haven't really managed to do that well. And so I think that, yeah, just having their voices involved in the whole of that all the way through and sort of really leading that change is vital, really. Yeah.
Yeah.
It's pretty amazing knowledge to acquire, really.
It certainly is. And I'm sure that, during the Youth Health Summit initiative will actually hear those voices and get some really solid actions come out of it as well. And as a health professional who works with young people, what are some of the ways you try to help young people feel comfortable when they're in hospital?
Yeah, look, I think that, one of our main things is just to let young people know that they're welcome there, that it's a place that sort of really belongs to them, that we do care about them and the way that they're feeling and what's going on in their life. And that, that we are there to sort of talk about some things that can feel really confidential and that they worry about, and that we can support them through that process. Often hospital can either be a time of crisis for some young people, but even if it's not, it can still be quite frightening. So I think that, just for them to sort of know that actually they are safe and that, they matter, and that what we're trying to do is match what they need. And, really that's just, is a key message, I guess. Yeah. Everything else that comes after that. Yeah.
Well, thank you so much, Rachel, for joining the podcast today. Did you have anything you'd like to add or a message you'd like to send out to young people?
Look, I guess, like, for me, it's just, I remember when I was, a young person myself, and sort of always, sort of sometimes questioning myself about, whether, I guess, the sort of knowledge or this that I had to bring to the table, especially when I was sort of sat around older professionals or, very like senior sort of other professional people. I was thought, oh, what's my place in this sort of conversation? But I think that actually it's just about having that confidence, to know that they have really unique perspectives, and like really valuable perspectives, and that actually like they're the people that should be there the most. So just something that I guess I took from, my own experience as well.
Yeah. I think that's amazing advice for our young people. And so thank you again. And that was the 5th episode of our Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices. It is always so inspiring to hear what individuals, services and health and research professionals in Australia are doing to make a difference to young people and their well-being. Great to hear how they can adapt in response to the needs identified by young people and the importance of listening and engaging our young people as well. Thank you. If you can, please support the Youth Health Summit initiative by getting in touch via the Menzies School of Health Research website. Thank you for listening. Please join us again next time.